Thank you to everyone for joining us for this session on providing healthcare in conflict. My name is Sara Jerving. I'm a global health reporter at Devex, and I'll be moderating this panel. Conflict destroys health systems. Facilities are damaged and vandalized, health workers are killed, and populations are left without treatment in a context where they need it the most. Health systems have been increasingly a target in conflict, and sometimes this destruction is deliberate, which is a violation of international law. Today, we're speaking to three experts who have experienced firsthand the devastation brought by conflict on health systems. We're joined by Dr. Mohammed Abbas, who is Regional Program Manager for the Middle East and North Africa at MedGlobal. He's based in Yemen. Jaime Nadal, who is the United Nations Population Fund Representative to Ukraine. And Dr. Hayelom Kebede, who is former Chief Executive Director at Eider Comprehensive Specialized Hospital in Tigray, Ethiopia. Dr. Kebede, if we can start with you. Tigray's health system has collapsed. Much of the destruction, looting, and military occupation of health centers in Tigray happened between November 2020 and June 2021. Can you talk about your experiences during that initial period of the conflict as your role as Executive Director at Eider Referral Hospital in Mekelle?
Thank you very much, Sara, and thank you for inviting me to talk about health systems before the war and after the war. So just for everybody to understand that before the war, health system of Tigray was one of the modest in the country, and it had more than 47 hospitals and more than 20,000 workforces. And when it comes to Eider, Eider is one of a university hospital in a country which gives service for more than 10 million, which includes the whole 7 million population of Tigray and population of Afar, and also some of regions from the neighboring region. So it is one of, and we have around 360,000 patients are visiting annually before the war. And so this university hospital is very specialized because it gives many specialized services like dialysis and cardiacs and diabetics and many others. And it has also students with residents with many medical students and paramedics. So this is one of the hospital has more than 600 beds, and it makes the university hospital second next to Addis Ababa University, which is found in the capital. So this university hospital is really quite tremendous service for the region and for the country. This was before the war. When the war started, now things has been changed upside down. And in early times of the war, when our capital, Mekelle, was occupied by the military conflict actors, and the hospital was totally collapsed immediately. And this is because one, there is no electricity, and the other thing is there is no medical supply, and the other one is the health workers are a very difficult situation because there is a curfew imposed in the capital, which starts on November 29. So that makes people not moving and helping patients. So during in early times, three kind of patients are coming to our hospital. One is a very high number of girls and women who have been raped. And the other ones are people who have been also sustained injuries because of the shellings. For instance, when Mekelle was occupied, the capital of the region was occupied in November 29. And what happened is 20%, 23% was died, and 73% was came to hospital of sustained injury. So this was just we are so unprepared for large mass of casualties coming to the hospital. So quite a lot of people are coming with high number of casualties, and some of them are died. So it was completely chaos in early times. And the other thing is also the girls and women are also coming. So we are not sure what's going on because they complaints of gang rapes and many things, and then we are not prepared for that. We are not sure what we can do with the girls and women who are coming to the hospital, and we have also chronic patients, and they are also coming and said they need insulin and they need dialysis stations and so on, and then we can't do that because there is no electricity and there is no supply. So in early times, it was a completely chaos that we can't manage all the patients who are flooding. And we ask some questions because it was early. Some of the hospitals were used to give some of the services. So people are not only coming to our hospital. And we ask what was happened. And then everybody told us there is no, everything was vandalized and looted and destroyed in the periphery. It's only this hospital that survived. And we were just, so you can imagine one of the modest in the region and in the country was completely collapsed. So more than 200, we have more than 47 hospitals and more than 230 health centers. All these are collapsed. So everybody is coming to our hospital for help. That we can't help. We can't give services because it's overwhelming. And it's also the war is also continuing, and our colleagues are not also have a chance to move around because there was a curfew was imposed, so everybody is not allowed to move. So it was in early times, it was really very difficult to manage, and all this we are unprepared of that time.
Okay, thank you so much, Dr. Kebede. Jaime, UNFPA has raised the alarm in recent months about the needs of pregnant women, new mothers, and babies in Ukraine. What are those needs and what are the challenges your teams are facing in delivering services and reaching those in need?
Thank you, Sara, and thank you for inviting me to this very interesting discussion and very pertinent, I have to say. Yeah, indeed. Let me give you some figures as well. We estimate that there are about 265,000 pregnant women in Ukraine. Out of them, about 80,000 will be giving birth in the next 3 months, and about 11,000 of them will develop complications during pregnancy and during delivery. And of course, as Dr. Kebede mentioned, these women and new mothers are among the most vulnerable ones in the war in Ukraine, but I think in any conflict, not just in Ukraine. And we know, based on our experience, that in times of greater stress, the risks to health just intensify exponentially. We know that pregnant women are at higher risk of miscarriage, preterm labor, premature birth, and other complications. We also know that the number of preventable maternal deaths also increases due to the lack of access to prenatal and postnatal care. It is precisely what Dr. Kebede was explaining about Tigray, is exactly what is happening here as well. The moment when those services are most needed is when those women lack precisely those services. What we are seeing in Ukraine is not very different from the situation that was described. We also have health facilities that have been damaged. We also have cities that have been under shelling for very long. And we have also seen, and this is perhaps the difference, that there have been attacks against health facilities. So all these factors make women altogether very afraid of seeking any kind of treatment, accessing health facilities, and accessing life-saving services that are related to the reproductive health. So what is UNFPA doing? Well, all our efforts are really focusing on helping pregnant women receive antenatal checkups, skill attendance at delivery, and postnatal care services. Now, how do we do it in Ukraine? And I think the context in Ukraine is probably very different from the context in Tigray. But we are trying to guarantee a steady supply of life-saving commodities. We want to make sure that health workers have the necessary medicines and equipment to deliver high quality or the best possible quality care to all pregnant women and newborn babies during the war. And we are working with health professionals to reach pregnant women and new mothers through, for instance, mobile reproductive health clinics that provide primary healthcare services as well as referral to specialized facilities. I can give you an example, for instance. We've been equipping health facilities with much needed equipment, medicines, and reproductive health kits. So far, we have shipped 54 metric tons of supplies to maternity hospitals in areas like Chernihiv, Sumy, Kherson, Mykolaiv, Kiev, Dnipro, Zaporizhia, Kharkiv, and Poltava. Well, for anyone who knows a little bit of the geography of Ukraine, these areas are the areas that have been directly affected by war operations. And we've been making sure that there was a steady supply of commodities to the hospitals, so the hospitals, the health system would not collapse, which is, again, what was presented about Tigray. The fact that the system collapsed, well, we've been trying to secure the supply of those commodities to keep the system up and running, to keep the system functional. Very soon, we will be receiving about 27 metric tons of supplies, and we hope that we will continue scaling up our interventions. At the end, our goal is that no woman dies while giving birth in Ukraine.
Thank you, Jaime. Dr. Abbas, about half the health facilities in Yemen are non-functional, and even the functioning half are only operational to varying degrees. Can you talk about some of the challenges your teams have in providing health services given this extensive damage to the system?
Yes, thank you first for giving me the opportunity to talk about the Yemen needs and the humanitarian needs in Yemen. So first, I will talk about, in general, about the situation in Yemen. As you know, more than 7 years of armed conflict in Yemen has caused tens of thousands of civilian casualties and displaced over 4 million people, making Yemen one of the world's largest humanitarian crisis and aid operation. When we're talking about the health in Yemen, from the last HNO, more than 21 million people in needs, high needs for health support and health services, and it was reported in the last HNO also, like more than 12.6 million people are in acute need for health assistance. For overview of the health system here in Yemen and the health condition of the people in Yemen continue to deteriorate in the wake of index of conflict, which have deficit the public health system. According to the last 2021 HERMs, like more than 49% of the health facility are either non-functioning or partially functioning. For those who are partially functioning or working, they have a big issue of struggling with the severe shortage of medical equipment, supplies, and also staff. Lack of staff is very common here in Yemen, and also only like 80% or 11% of the health facility who are already functioning or working, they haven't got a qualified staff. So for us, MedGlobal here in Yemen, we are providing health services in the health facilities. We are training the staff. We are hiring the staff because with the current conflict, most of the staff they leave the country and they are now displaced to another area. So we are trying to have a higher staff to continue providing the health services in that rural area. We are having more modalities. We are supporting the healthcare in the community through a mobile team, and also we are running the two hospitals and health facility, which can also facilitate the referral system between the community level and the district level.
Thank you, Dr. Abbas. Dr. Kebede, the Ethiopian government has restricted the amount of medical supplies and other aid brought into Tigray. What sort of things are you hearing from your former colleagues about the health situation in the region?
Yeah, it's the reality, the big reality that we are currently seeing. So colleagues, I have every day contact with my colleagues in the ground, and they are telling me it's getting worse and worse. And so we can't just categorize it in three. So starting from November up to June, at least there was a minimal or a little transportation of medicine. So some medicines are coming, not enough, but at least people can move from Mekelle to Addis, and there will be some sort of mobility in a population. But starting from June till now, it was a complete siege and a complete blockage of everything which is coming out in and out. So it's completely devastating. So colleagues are telling me that there is no medicine at all in some areas, particularly the WHO, ICRC are trying to provide, but medicine is just, it's like, unless you have a sustained way of storing or medicines coming out. So it's not just one time giving services. So it's every time you have to supply. So there should be supply, and the demand has to be continued progressively. But now it seems that ICRC or WHO may drop some medicines this week, and then for the coming months, and then it was completely stopped. So this cannot work in a medical arena, because there should be a continuous supply of medicines and also consumables for all medical services. So what's happening is the government is purposefully and blocked, and so that the people in Tigray can be subjugated or to be submissive to its ruling attention. So it's not acceptable that to use this humanitarian blockade as a means of war, because at least the government can do just give a free access or for NGOs, for UN agencies to move in and out, and people can move in and out, so that they can make a negotiation. But it looks like it was completely blocked, and people are dying in three things. One is there is high increment of malnutrition in children. So it reaches more than now 30%, and it used to be below 10 for the war. And the other thing is those who have been sexually raped, and these are in a very emotional trouble, that emotional problem, because they didn't get any sort of treatment of healing to go to the community. And the other thing is people who have suffered with chronic illnesses like diabetics and dialysis. They have been just dying because, yeah, they couldn't even move, and they couldn't withdraw their money from a bank because the bank is blocked. Every service is blocked, so they cannot go out from the region, go to Addis, because there is no transportation. So the people telling me on the ground is it's human tragedy in this 21st century that the world is seeing, and 6 and 7 million population is just dying. So it's a matter of time that all the population may be died if things are not changing in the coming months. So it's getting worse and worse every day and then in every time. So people now, some of very diseases which can be prevented by a very easy way, people are dying because there is no any electricity, and the hospital is not functioning. The lab agents and the medical equipments are not working. So people just give the some of the medications which comes from WHO, ICRC, and some other in agencies. They just give them, and without giving some sort of investigation on the disease. So many preventable diseases are now very common, and people are dying. So the dying, the impact will have in the next 10, 20 years in the coming year, and then that generation will have impacted. So people telling me, even colleagues by themselves, they are in a very difficult situation. So it's really horrific that what's happening in Tigray. It's a multifaceted problem: food crisis, medical crisis, and everything crisis in the region, where people, 6 and 7 million people, are just in a hostage and in a complete blockage by systematical by its own government. So unless the government on an international community intervene, it will be another catastrophic of 6 and 7 million population will die, because you cannot live for months, for years, with a complete blockage and siege. And then if this will not be changed, then the fate of this whole population is just to die. So, I know people much attention was because many conflicts are coming these days. There is a conflict in Ukraine, in Yemen, and also elsewhere. But this one is a very peculiar one, because it was 360 siege, and it's not allowed people even to flee, and are not people are allowed to move around or to withdraw their money even in a bank, because bank is completely blocked. So in my view, and people telling me that this will continue in the coming months and weeks, then we'll see it will be catastrophe. Many of colleagues, because everything was collapsed, and will be very tragedy of this thing.
And Jaime, can you talk a bit about the scale of gender-based violence in the conflict in Ukraine? What sort of services do survivors need, and what are some of the challenges in providing these services?
Yes. Well, the scale of the displacement. Let me start with providing you with the broader picture. No? The scale of the displacement is massive. I mean, yesterday, we crossed the mark of the 8 million internally displaced population. Over half of them are women and children. We have gone over the 5 million mark in terms of refugees, over 90% of them being women and children. And we know that women and girls in particular, who find themselves in the middle of hostilities, on the move, at border crossing points, in bomb shelters, with host families, they all face increased risks of sexual and physical violence, exploitation, and abuse. And let me also share with you that we have to be very careful with the data and with the figures and the numbers that we use. We also know that the data that is reported on sexual and gender-based violence do not always paint an accurate picture of the extent or the occurrence of gender-based violence. Let me give you an example. The national hotline that we have in Ukraine, operated by La Strada and supported by UNFPA, received this week alone reports of 184 cases of gender-based violence. However, we know that in an emergency like this, the number of cases of violence recorded and the available data do not represent the true magnitude of the violence. It's just the tip of the iceberg. So our priority at UNFPA is to ensure that survivors of gender-based violence and survivors of conflict-related sexual violence have access to comprehensive support services, the services that they need, that we apply a survivor-centered approach, one that includes the clinical management of rape and post-rape care treatment for cases of conflict-related sexual violence. Why? Because the more that those services are available, the more women will be likely to seek assistance and support. The needs are rising very fast, and unfortunately, the services for women who have suffered sexual violence, including rape, are very scarce on the ground. They are almost non-existent. So, as I said before, expanding the number of services and expanding the range of services they can access is our top priority. This is why we have increased our protection and response services for survivors. We are working with partners on the ground to prioritize their needs, their rights, their wishes, And we are coordinating at this point in time about 10 shelters, 8 crisis rooms, 3 daycare centers, and 9 service delivery points, prepositioning supplies and distributing dignity kits to ensure that the survivors of violence, especially survivors of sexual violence, receive life-saving care and the kind of assistance that they require. A challenge that we face has to do with the fact that it's an underreported crime. It's an stigmatized issue, even in peaceful times. Many women are afraid to report those cases, to seek assistance for a variety of reasons that may be related to limited access to life-saving information on the issue, lack of access to specialized services, fear of the stigma associated with this kind of violence, the state of shock or denial that they may be going through, and many other reasons. No? We may also confront a situation whereby the facilities, as is happening a lot in Ukraine, have been damaged or destroyed, and that the resources are just stretched or diverted to respond to the needs of displaced persons without entering into specific problems or specific cases. Many service providers, I don't know if this is the case in the other crisis that we are talking about today, but it is the case in Ukraine. Many service providers have themselves been displaced. And the referral systems that used to exist before the war have been completely disrupted. So what we are doing, we're deploying mobile teams, reproductive health mobile teams that include obstetricians, physical therapists, and nurses, and psychosocial support mobile teams with psychologists and social workers. We have already expanded or established these services to 12 regions of Ukraine, and they offer really and truly life-saving and much-needed services and referrals for those women and health and girls. We also provide reproductive health kits, supplies, and equipment to health facilities, as I mentioned before. And we are distributing women essential packs and dignity kits, which contain basic hygiene items for women and girls, including for their menstrual hygiene. And last but not least, we are adapting very fast our programming in Western Ukraine to respond to the growing needs of the population. I mean, the services that were available before the war were designed for a relatively, I don't want to say small population, but for a population that was X. And now we've seen that this X number has increased exponentially in these parts of the country. So taking things to scale is really one of the major challenges and one of the top priorities that we are focusing on these days.
Okay, thank you. Dr. Abbas, the primary health system has been heavily damaged during the conflict. Because of this, many people don't have that first line of care. And that overwhelms secondary lines of health, such as referral hospitals. Can you talk a bit about the implications of this?
Yes, according to the recent ongoing conflict, this led to complete collapse of the health system, especially in the primary health care, where in the rural area. And this led to increase the prevalence of the communicable disease and also the preventable disease. Like we're talking about like the vaccination outbreaks and of the diseases of the outbreak, communicable disease, including like vaccine, preventable disease like cholera, spreading of cholera, diphtheria, dengue fever, and measles in the countrywide. This with the declined routine immunization covering in the country because of the collapse of the health system and also to the destruction of the primary health care. And the second part also because of the increase the cost of the transportation and also with the lack of the fuel, so people cannot refer or visit the secondary health care. So one of the programs which we are providing here in Yemen is to ensure that we are providing a referral system between the community level and the rural area to the secondary health care, where most of the secondary health care was overwhelmed with the increased number of the cases, especially with the IDPs who are moving from areas to areas, and also the collapse of the health system. This leads the secondary health care also to cannot providing the complete services needed to the community. especially even the secondary healthcare. They have a severe huge lack in the supplies, in the medications, in the medical equipment, and also there's no enough specialists in this secondary healthcare. All of
And
this,
Dr.
which is leading
Abbas?
from the implication of the collapse of the health system inside the country.
Thank you so much. I'm so sorry. We unfortunately have run out of time, but
Yes,
I
can
want
you hear me?
I can hear you. Yes, thank you. I'm sorry. We've unfortunately run out of time. But thank you so much to our three panelists for bringing us these stories from the incredibly difficult situations in Ethiopia, Yemen, and Ukraine. And thanks to everyone who tuned today.
Thank you very much to you.